Good morning, students. In today's lecture, we would be discussing about the anatomy of the anterior triangle of the neck. This diagram is a very beautiful presentation of the various boundaries and subdivisions of the anterior triangle of neck. So the boundaries of the anterior triangle of the neck, superiorly, this line is representing the base of the mandible. So this is the base of the mandible, this is the angle of the mandible. So the superior boundary of the anterior triangle of the neck is the base of the mandible and an imaginary line joining the angle of mandible to the mastoid process behind. Behind the ear, there is a mastoid process. So the superior boundary is the base of the mandible and imaginary line joining the angle to the mastoid process. Medially, the anterior triangle is formed by the anterior median line. This red dotted line is the anterior median line and it forms the medial boundary of the anterior triangle. Laterally, that is on either side, the triangle is formed by the sternocleidomastoid muscle. This line represents the anterior border of the sternocleidomastoid muscle. So this entire is the boundary of the anterior triangle. But this triangle, because of the two muscles, you can see here, this is the digastric muscle, this is the anterior belly of the digastric, this is the posterior belly of the digastric, and this is the superior belly of the omohyoid muscle. So because of these two muscles, this anterior triangle is subdivided into four smaller triangles. So अगर ये muscles, digastric muscle and omohyoid muscles नहीं होती तो ये सब डिविजन्स नहीं होते और ये सिंगल ट्राइंगल होता, लेकिन बिकॉज ऑफ दीज मसल्स they are subdividing this triangle into four small triangular spaces and they have their individual names on the basis of the contents that lie in these triangles. So we will discuss in detail one by one about the different triangles that form part of the anterior triangle of the neck. So with this figure also, this is also a very beautiful diagrammatic presentation of the different boundaries of the anterior triangle as well as the subdivisions. So this is an important diagram and it will help you memorize the anterior triangle with all its subdivisions and its boundaries. So you can see here the superior boundary is the base of the mandible and a line joining the angle to the mastoid process. The medial boundary is by the anterior median plane of the neck. This is that plane. And on either side, that is the lateral side, is formed by the anterior border of the sternocleidomastoid muscle. And also the triangle is subdivided by the digastric and the superior belly of omohyoid into four different triangles. So there are total 8 triangles, 4 on one side. So the subdivisions are submental triangle, digastric or submandibular triangle, carotid triangle and muscular triangle, and these are subdivided by the digastric muscle and the superior belly of the omohyoid. So we will discuss about these triangles one by one in detail. First is the submental triangle. So you can see here in the figure, this here in between these two bellies, this space is the submental, just below the chin. For chin in anatomy, we use the term mental. So below mental, below the chin, there is a triangular space and that is why it is known as submental triangle. So its apex lies on the chin. It lies at the chin. On either side, it is formed by the anterior belly of the digastric muscle. These two are the anterior belly of the digastric. Base is formed by the hyoid bone एंड द फ्लोर जैसा मैंने आपको प्रीवियस वीडियो में पोस्टीरियर ट्राइंगल में भी बताया था दैट फ्लोर इज मोर और लेस इट इज फॉर्म्ड बाय मसल्स. सो फ्लोर जो है इसका बैक साइड में आपको जो मसल दिखती है दैट इज द माइलोहायोइड मसल. द राइट साइड एंड द लेफ्ट साइड माइलोहायोइड मसल जो हम ऑलरेडी डिस्कस कर चुके हैं इन द सुप्राहायोइड ग्रुप ऑफ मसल्स. सो वो जो मसल है और जो बीच में मीडियन रफे है जॉइनिंग द टू मसल्स that forms the floor of the submental triangle. So submental triangle is the most median triangle. Its apex is at the chin. On each side, anterior belly of digastric, base is formed by body of hyoid bone, and the floor is formed by the right and left mylohyoid muscles as well as the raphe that unites them. Can also be seen here. This is the submental, just below the chin. Contents. As it is submental triangle, so it contains submental lymph nodes and submental veins. So 2 to 4 small lymph nodes situated in the superficial fascia between the anterior bellies of the digastric muscles. So these are the anterior belly of the digastric. In between them, here in the superficial fascia, there are 2 to 4 very small group of lymph nodes and they are known as submental lymph nodes. It also contains submental veins which are small and they join to form anterior jugular vein. So that's all about the submental triangle. Next is the digastric or the submandibular triangle. So the triangle that you can see here is known as the digastric or the submandibular because this is the submandibular region, so this is also known as submandibular triangle. This triangle, it is formed anterior-inferiorly by the anterior belly of the digastric. This is the anterior belly of the digastric. So anterior and inferiorly it is formed by this. Posterior-inferiorly it is formed by two muscles, that is the posterior belly of the digastric. This is the posterior belly of the digastric and this is the stylohyoid muscle. From the styloid process to the hyoid bone, this is the stylohyoid muscle. So this is the anterior inferior boundary, this is the posterior inferior boundary, and superiorly or the base is formed by the same the base of the mandible and the line joining the angle of the mandible to the mastoid process, the imaginary line that joins the angle to the mastoid process. So that is the boundary of the digastric triangle. Now the roof of the triangle is basically consists of skin. Skin के नीचे है superficial fascia and superficial fascia के नीचे है deep fascia. So the superficial fascia contains the platysma muscle, which is the most superficial muscle of the neck. It also forms part of roof of the posterior triangle and it also forms the roof of the digastric triangle. It also contains the cervical branch, facial nerve जो neck में branch देती है, that is the cervical branch and that lies in the digastric triangle, and also cutaneous nerve of the neck because it is the anterior cutaneous nerve and it is going above, so it is the ascending branch of the anterior cutaneous nerve. And the deep fascia, it splits to enclose the submandibular salivary gland. We have already discussed about this splitting of deep fascia and covering the submandibular salivary gland in our video on the submandibular salivary gland. Floor of the triangle, as in case of the other triangles, जैसे बाकी triangles में muscles floor बना रही हैं, even in the digastric triangle, the floor is formed by three muscles. One is common, जो submental का floor भी बना रही है, that is mylohyoid muscle. Second is the hyoglossal muscle, which is the muscle, extrinsic muscle of the tongue. And a small part is contributed by the middle constrictor muscle of the pharynx. You can see here in this figure, this is mylohyoid muscle. This is mylohyoid, this is hyoglossus, and from the back side, you have the middle constrictor, that is just a part of the middle constrictor. So these three muscles basically form the floor of this digastric triangle. Now the contents of the triangle. So the contents divided into two: contents in the anterior part, contents in the posterior part. So the contents in the anterior part, you can see here in this figure, this is the chin, this is ear, so this is the anterior portion of the triangle, and the most important structure that, or the most important content of the digastric triangle in the anterior part is the submandibular salivary gland, and that is why this triangle is also known as the submandibular triangle, because it contains the submandibular salivary gland and also the submandibular lymph nodes. Then it contains the submental artery, which is branch of the facial artery. So facial artery जब below the chin आती है, तो it gives a branch which is known as the submental artery, that is also contained in this triangle. It also contains, because इस triangle के floor में contribute कर रही है mylohyoid muscle, so it also contains the nerve to mylohyoid and vessels to mylohyoid muscle. It also contains the hypoglossal nerve, because floor is also formed by the hypoglossal muscle, so it also contains the hypoglossal nerve, and it contains the facial vein and the facial artery. Facial artery lies slightly deep. It is not a superficial structure, it is slightly deep. So these are the contents of the anterior portion of the digastric triangle, and all these structures are superficial to the mylohyoid except the facial artery. Now the contents of the posterior part. So the contents of the posterior part are divided into three categories. In this, there is a description of the contents of the anterior part. So you can see here the contents of the anterior part have been described. Now we'll discuss about the contents of the posterior part. We divide the contents into three portions. Contents that lie superficially, then there are structures that lie deep, and then there are structures that lie deepest, that is deepest even to the sternocleidomastoid, below the sternocleidomastoid muscle. So if we talk about the superficial content, you can see here, this is the parotid gland. So the lower part of the parotid gland forms the content of the digastric triangle and the content of the posterior part of the digastric triangle. And the artery that you see here, this is the external carotid artery. So these two are the superficial contents of the posterior part of the digastric triangle. Now if we talk about the deep contents, they lie between the external and the internal carotid. Internal carotid is still deeper. The internal carotid artery is still deeper. And the contents are the styloglossus muscle, stylopharyngeus muscle, glossopharyngeal nerve, vagus nerve, especially the pharyngeal branch of the vagus nerve. Vagus nerve की pharyngeal branch, the styloid process, and part of the parotid gland. This parotid gland, part of this gland is also in the deeper portion. And deepest you have the internal carotid artery, internal jugular vein, and also the vagus nerve. So you can see this internal jugular vein and the internal carotid lie even deep to the sternocleidomastoid muscle. So they form the deepest content of the digastric triangle. So basically, the contents are either arteries, glands, salivary glands. One is the submandibular in the anterior part. In the posterior part, you have parotid gland. And just the lower part of the parotid gland lies in this triangle. And you have important nerves. That is, anterior part mein you have the hypoglossal nerve. And in the posterior part, you have, in the deep relation, you have the glossopharyngeal and the vagus ki you have the pharyngeal branch, and if you go still deepest, you have the vagus nerve. So there are nerves, arteries, muscles, and the salivary glands that form contents of the digastric triangle. So that's all about the submental and the digastric triangle. The remaining triangles we would be discussing about in the next video. Thank you so much.